Welcome to JFK. It's our pleasure to take care of you when you come here after your surgery. I'm going to talk to you a little bit about nursing and what to expect while you're here at your stay at JFK. First of all, I'd like to talk about medications. Before your surgery, you're going to meet with your medical doctor. I want you to review all your medications with your doctor to find out which medications he would like for you to stay on, which medications you may need to stop prior to surgery. Some of those medications could be like Coumadin, blood thinners, and your doctor will tell you when you need to stop those medications at that time. It's very, very important to have a list of your medications with you at all times, with the names of those medications, your dosages, and the frequency that you take those medications. Always have that with you. You may be asked for that list the morning of surgery, and then also when you come up to the floor post-operatively, your nurse is also going to ask to see that list. And it's just going to be easier for you because from being under anesthesia, you may be a little groggy, just to be able to give that list to the nurse, and that way you can continue the medications that need to be continued post-operatively. Leave all your medications at home. That's why we want you to have the list. You don't need to bring any of your medications that you take at home here with you at the hospital. Pharmacy will set you up and get your medications started that you need to be on, that your doctor has agreed upon. And any medications that our pharmacy doesn't carry, or they may be specialty medications, you will be notified of those medications that you may need to have brought into the facility. Pain management. Pain management is very, very important to us. We need to hear your voice. You're going to have to be your advocate as to what tolerance of discomfort you're able to handle here. First of all, after surgery, there's going to be several choices of pain medications. Some may be injections, where it's going to go into your IV, and some may be oral medications. After surgery, yes, you are going to have some discomfort. That's to be expected, but our job is to help keep that discomfort as low as possible so you're able to do your physical therapy, do your occupational therapy, and that's what your nurse is here for, and we'll be using what's called a pain scale. That's 0 to 10. 0 being absolutely no pain, 10 being that the pain is off the charts and you just don't want to move. What's important with the pain scale is that's our communication tool that you're going to use with your nurse so we can evaluate what type of pain medication you may need. A big thing here is you need to ask for your pain medication. You don't want to allow your pain to get to a 5, 6, or 7 because it's harder for us to pull that pain back in and get you at a more comfortable level. So when you start to ache a little bit, let's say a 2 or 3, you're going to call your nurse and let her know that you are in pain. The pain medications are as needed, so you must ask for them. They are not scheduled medications. Again, with the injections, that would be if you did allow your pain to get to be, let's say, 6, 7, 8, we would use an injection into your IV in order to bring your pain back down. If you're a 2 or a 3, then we would use the oral medications at that time to keep you at a nice, comfortable level so you can proceed with your physical therapy and occupational therapy. Your nursing care after surgery, you are going to have a registered nurse, a patient care assistant, what's called a PCA, and we have a board in the room that's called a whiteboard. This is your communication tool for you communicating to the nurse and to other staff members on the unit. It's very, very important to keep in touch with your nurse. We have what's called SpectraLinks. They're little phones that we each carry. Your PCA will have one, your nurse will have one, the charge nurse, and etc. That's a phone number that you will call from your phone. You will directly get your nurse or that PCA. The whiteboard will be updated every shift, and as things change with your status, weight-bearing status, or your diet, that board will be updated so you can see specifically in front of you, okay, who's my nurse right now, who's my PCA, what kind of diet am I on, what kind of status as weight-bearing status do I have at this point. All these things are on a whiteboard in your room. If you can't get a hold of the staff via SpectraLink, we also have call lights. There's 2 on either side of the bed, and you also have a handheld call light. So we have 4 different ways that you're able to get a hold of a staff member if you need assistance. Daily diary, we have little diaries that will be at your bedside after you come up from post-op. You will not be receiving this preoperatively. It's a little diary that you can keep, and you can write what doctor came to see you, what specialty, if it was the medical doctor, if it was the orthopedic doctor, what did they have to say. You also can write in who's your nurse and also their SpectraLink number. If you have a problem seeing the board, please let your nurse or PCA know that so we can write it down for you so you're able to visibly see how to get in contact with your nurse or with your PCA. You can make notes. I think it's very important that when you think of a question that you want to ask your doctor, please just jot it down. That way you have it here ready for when they walk in. You can say, okay, doctor, I have this question for you. Joint Street Journal. This is going to come daily. And what it is just an information brochure that lets you know kind of what to expect for the day, what's going to be coming up the following day, and just gives you general information about the type of joint replacement that you have had.
Hello, I'm a physician and a member of the JFK Hospital Department of Anesthesiology. Here at JFK Hospital, we endeavor to make your experience in orthopedic and other surgeries as pleasant as possible. Our hope is to make this as pleasant an experience as possible for you. We focus primarily on your comfort and safety. Every patient coming for surgery at JFK Hospital will meet with an anesthesiologist. The choice of anesthesia will ultimately be made by the anesthesiologist and the patient, as well as the surgeon. The choice of anesthesia is specific to the patient, their past medical history, the surgery they're having, and any specific preferences that the patient and the surgeon may have. There are three types of anesthesia that you may undergo. One is a general anesthetic. Many patients are familiar with general anesthesia. General anesthesia is a process whereby we put you under a state of anesthesia, rendering you unable to feel, hear anything, or remember anything. We also have to breathe for you. Many surgeries are performed under general anesthesia today. Some patients, and alternatively some surgeons, prefer what we call a regional anesthetic, where we anesthetize only a region of your body. This can be accomplished in a number of ways. If we need a brief anesthetic, several hours or less, we may elect to do a spinal anesthetic. This is a painless injection in your back that will numb you up, usually from about the mid-waist on down. In addition to the spinal anesthesia, you're provided with intravenous sedation to keep you comfortable and relaxed throughout the process. For surgeries that are longer, or for patients who may require pain management after the surgery, we may elect to put in an epidural. An epidural is similar to a spinal, although a catheter is placed and left in the patient until the patient is comfortable, usually 2 or 3 days after the surgery.
When you come to the hospital for your shoulder surgery, it's important to bring comfortable clothing. We prefer that you bring in shoes that are comfortable yet supportive. We find that the shoes that are the sliding type of shoes, like Crocs or the Skechers without the back, work very well for people. Also bring any dentures, hearing aids, or eyeglasses. The hospital does provide toiletries like toothpaste, toothbrush, body wash. But if you'd like to bring your own toiletries, please feel free. Also, cell phones are permitted, so please bring your cell phone if you'd like. Electric razors are permitted, however, straight razors are not. So if you'd like to shave while you're here, please bring your electric razor. You will be on a blood thinner, and therefore, straight razors are not permitted. After your surgery, you'll be working with an occupational therapist here at JFK. The occupational therapist will assist you in relearning how to perform your activities of daily living, like bathing, dressing, grooming, after your surgery. That way, you'll be safe to go home. If you're going to a rehab center, you'll work with your occupational therapist at the rehab center. However, if you're going home from JFK, you'll be working with an occupational therapist here.
Physical therapy is an integral part of your recovery at JFK Medical Center. You'll be seen by physical therapy 2 times a day. With physical therapy and your participation, we can get you back on the road to recovery as soon as possible.
Hello everyone, my name is Sharon Mashburn. I'm with JFK Case Management Services. My job is to facilitate your discharge from this hospital. In regards to your total hip surgery, this is what you should know. You will come in for surgery and normally you're discharged 2nd to 3rd day post-op. It just depends on how well you're doing. If you're planning to go to rehab, we would like you to make 3 choices. We will come by and see you the day after your surgery to get those selections from you. We will send out those referrals as we get them from you, and depending on which one you select, or which one is available will determine where you go. If you're planning to go home, we will make the arrangements for your home health. Those companies will see you the day after you're discharged from the hospital. You will need a medication for DVT prophylaxis, either Coumadin or Lovenox, depending on your surgeon. You will go home with some DME equipment. That equipment is either a rolling walker or a 3-in-1 commode. All right, if you're going to go home with the hip, you will have your rolling walker delivered to the room the day after your surgery. And your home health company, you will know who the home health company is because you have an opportunity to select it. Or your doctor may recommend a company. If you do not like your doctor's recommendation, you can go with the one that you're familiar with. If you have an HMO plan, I have to let you know that we have to stay within the realms of your HMO plan. Therefore, they usually determine who we can send the referrals to. Humana selects it. Humana tells us, Coventry tells us, Blue Cross tells us, Cigna tells us. We cannot select, and you do not have the option of selecting your home health agency. With Medicare, there is a list. We will give you that opportunity to select one if you do not choose to use one that your doctor has recommended.